If you're dealing with pain on the outside part of the hip, the most common cause is gluteal tendinopathy. In this video, we'll talk about why it's gluteal tendinopathy and not greater trochanteric bursitis, along with a two-stage rehab approach to help increase the strength of the tendon and reduce pain. The diagnosis of pain on the outside of the hip has evolved quite a bit over time. Historically, this was diagnosed as greater trochanteric bursitis, which was later referred to as greater trochanteric pain syndrome. But research shows in most cases, the real issue is the gluteal tendon and not the bursa. So the correct term is gluteal tendinopathy. And while this might seem like a small detail, it actually matters a lot. If you assume it's a bursa problem, then you might turn to treatments like a corticosteroid injection to help reduce the inflammation. But those injections can actually weaken the tendon and slow down healing. So accurately referring to it as a tendinopathy helps to direct treatment in the right direction, which means progressive loading and not just inflammation management. However, when treating gluteal tendinopathy, it's not just as simple as progressive loading. We also need to limit the positions that are causing irritation on the tendon. The gluteal tendon wraps around the hip and attaches onto the leg. And when the leg moves toward midline, it compresses the gluteal tendon against the bone, which can lead to more irritation. Common positions that increase the compression of the tendon against the bone include sitting with your legs crossed, standing with one hip pushed out to the side, and sleeping on your side. If you tend to sit with one leg crossed over the other or standing with your hip pushed out to the side, just be mindful to limit the amount of time that you're in that position. However, sleeping can be a little trickier. This is because good sleep is important for recovery, but if the position that you sleep in is irritating, then that's obviously a problem. So if you can sleep comfortably in a different position like on your back, then obviously trying to sleep in that position will be helpful. But if you can only fall asleep on your side, then placing a pillow underneath the knee will help to avoid those compressive loads. And now let's go over some rehab exercises. And these exercises are divided into two different phases, where the first phase, our main goal is to start loading the glute tendon without much irritation. And these are typically going to be with what are called isometric exercises, where the glute muscle will contract, but there's not much movement at the hip. A supine hip abduction is a great starting place, especially for a really irritated gluteal tendon. The setup is to lie on your back, place an exercise band around your knees or your ankles, with the ankles being the harder variation. Then push your knees or ankles out against the band until you feel the glute muscles engage. Hold this position for 30 to 45 seconds, then relax and repeat for 3 to 5 sets. The next exercise increases the challenge on the glute muscles in a standing position. Stand next to a wall with the outside leg being the leg that you're working, then push your knee into the wall like you're trying to move the wall away from you. You should mainly feel the glute on the standing leg, but you'll also feel some activation on the other side as well. Again, hold this position for 30 to 45 seconds and then repeat for 3 to 5 sets. Stage 2 exercises increase the challenge by adding load and movement. Generally, the emphasis is on heavy, slow loading of the gluteal tendon. This means that we want to load the tendon as heavy as tolerated. That will help to improve the structure of the tendon. And we also want to perform these slowly, with each rep being performed over 6 to 8 seconds. The first exercise is a hip thrust, and to perform these, ideally you use a bench, but a chair or a couch can also be used. Your upper back will be at the edge of the bench with your feet flat on the floor. You'll also want to keep your chin tucked throughout the exercise, as this will help to isolate the hips and not overload the lower back. Then from this starting position, bridge your hips up, driving through your heels, making sure to get full hip extension so your shoulders, hips, and knees form a straight line. Adding load with this exercise is important, whether it's using a backpack, a dumbbell, a kettlebell, or a barbell. Really just depends on what you have access to. Then the second exercise focuses more on hip abduction, so moving the leg out to the side. Begin by lying on your side with the painful leg on top. Placing a yoga block or a foam roller under the ankle can be helpful to make sure that the hip is in neutral and not drop down towards the ground, leading to compression of the tendon. Then slowly lift the top leg up towards the ceiling, keeping your toes pointed straight ahead or slightly down. Again, remember we want to perform these slowly over 6 to 8 seconds. A key point here is to keep your hips stacked and avoid rolling backward. This focuses the load on the glutes and not the hip flexors or the quads on the front of the leg. The final exercise is a squat, challenging the glutes in a more lengthened position compared to the other exercises. Start with your feet about hip width apart. Too wide, you'll perform more of a sumo squat, which will activate the adductors on the inside part of the leg, while being too narrow will be a little bit too much quad focused. Then to perform the squat, sit your hips back and down like you're lowering yourself onto a chair or a box. Keeping the shins more vertical while your trunk moves slightly forward will emphasize more of the glutes as opposed to the quads. For the stage 2 exercises, ideally we're performing them 3 times per week for 12 weeks. For the stage 1 exercises, we only want to perform them as much as we need to progress to the next stage. So hopefully this video on gluteal tendinopathy was helpful. If you have any questions, be sure to leave them in the comments below. And if you want to stay up to date on all rehab, be sure to subscribe to the channel as well.